So good afternoon, everyone. Thanks very much for joining us for the information session on the new VA healthcare eligibility under the PACT Act. My name is Dr. Aaron Jacoby. I'm currently the Acting Deputy Chief of Staff for Healthcare and Business Operations, and I'm here today on behalf of Dr. Vishal Vaghela, our Acting Chief of Staff at the VA Maryland Healthcare System. So many of you probably recall back in August of 2022, that's when the PACT Act actually went into effect. It was at that time the largest expansion of healthcare and benefits in VA history. In March of 2024, there was a further expansion that made even more veterans eligible for VA healthcare. So, whether you've heard of the PACT Act or not, we're glad that you're here today because we want all veterans to be informed so they can receive the healthcare benefits they've earned. Today, you're going to be hearing from two individuals who can best explain the latest updates on the PACT Act as they relate to VA healthcare eligibility and toxic exposure. Tamara Moses is our Advanced Medical Support Assistant in Enrollment and Eligibility, and she'll be speaking about that process. And Ashley Hanahan is our Toxic Exposure Screening Navigator. She will be providing further information about the toxic exposure screening process and all of the ins and outs. After those presentations, we will open the session for questions. We've assembled a panel of subject matter experts from the VA Maryland Healthcare System, as well as our partners from the Veterans Benefits Administration and the Maryland Department of Veterans and Military Families to address any questions you might have. Our session today will be recorded and made available online for those who are interested but could not join us today. You'll be able to find the link to the meeting on our website, maryland.va.gov, within a few days. To protect your privacy, please do not share your personal health condition or any personal identifiable information from the question and answer portion at the end of today's session. Before I turn things over to Ms. Moses, I'd like to give you a brief overview of the PACT Act. So as I mentioned before, the PACT Act was the largest expansion of VA healthcare at the time when it was, signed into law. It not only expanded VA healthcare eligibility, it also increased veterans benefits and expedited the veterans benefits claim processing. So not only can we actually process more claims, we can actually do it in a faster time frame. The PACT Act also strengthened our overall VA workforce by expanding the number of professionals that provide healthcare within VA. It authorized funding for the expansion of VA facility leases, so we were able to expand the footprint of healthcare buildings and infrastructure so that veterans can receive more care. And as you're going to be hearing a little bit more, it bolstered VA's dedication to expanding toxic exposure resources to veterans, educating veterans about toxic exposure and its impact on their lives, and also underscored the importance of conducting research in the area of toxic exposure and its impact on veterans. The PACT Act overall improved and expanded access to care for veterans, and it also improved VA's presumptive decision-making process for conditions that are related to military service. So as you're listening today to the guest presenters, as well as our subject matter experts, just jot down some questions that you might have for the Q&A session. We'll hold those questions to that time, and we'll try to do our best to answer all questions that you might have. Okay, so I'm going to turn things over to Tamara to provide information about the overall expansion of VA healthcare eligibility under the PACT Act.
Good afternoon, everyone. My name is Tamara Moses. I work in the Enrollment and Eligibility Center in the Baltimore VA, and I'm just going to go more in depth about the enrollment and eligibility process for first-time veterans who've never enrolled, or veterans who enrolled in the past and who are trying to regain access into our system. So, the first steps pertaining to enrollment, they have, depending on if they went in before 1980, September 1st, 1980, they can do as low as 1 day of active duty service time and be deemed eligible. But anytime after 1980, they will have to do 24 consecutive months of active duty time. Or if they were a reserve member or a National Guard member, they will have to be activated under Title 10 or a presidential a presidential emergency status, where either the president activates them under a state of emergency. There are four ways a veteran can become enrolled. They can go to our website at va.gov and click on Apply for Healthcare. They'll have to submit their application as well as their DD 214 online if they are able to. If not, they'll have to bring it in person. They can also call our national enrollment line and speak to an enrollment specialist, and they'll provide all their information over the phone. And if the enrollment specialist can see their DD 214 in their system, then they'll have to come in person and we'll upload a copy. We can also mail out a 1010 Easy form. That's the enrollment application form. We can mail a paper version of that to the veteran. They can fill it out and then mail it back in to us. We'll upload in the system between 5 to 7 business days, and as well as their DD 214. And they'll receive a letter in the mail indicating their priority group status, as well as their co-pays, co-pay exemptions, anything like that. They may also come in person as well, to my location, the Baltimore VA Medical Center, or the Perry Point VA Medical Center. They'll need to bring in an unexpired driver's license, state ID, or passport, as well as their DD 214. And if they are service connected, from 0% all the way to 100%, they can bring in their letter indicating that they are service connected, and we can look in our system and add all their service connection information into the system. Um, their service connections are b- their service connections also determine their priority group. On the lower end, 10 to 20, that's group 3. 30 to 40, group 2. Group 1 is 50 to 100%. Anyone lower than group 1, they have to complete what's known as a financial assessment to see if they'll have copays for care and medication at the VA, um, as well as to determine their priority group status as well. There are times when they may not be eligible because their income is too high above the threshold based on their geographical zip code, as well as how many dependents they have. Based on their dependents or based on their financial income at the time, we base it off of the year before. We'll submit what's known as a HEC alert to determine if they are eligible for anything under the PACT Act, anything under TARA, the Toxic Exposure Radiation Act. There are three cohorts that we can put them in for. Cohort 1 is the air pollutants, chemicals, occupational hazards, radiation, anything from burn pits, pesticides, jet fluid, nuclear weapons, anything like that. That's warfare agents, nerve agents, anything like that. That's cohort 1. Cohort 2 is based on their geographical location. Before 19 on or after 1990, it can be in places such as Iraq, Kuwait, Saudi Arabia, Somalia, the UAE, United Arab Emirates. Anything after September 11th, 2001, Afghanistan, Egypt, Jordan, Lebanon, or any of those locations. If they're in there from that time frame, we'll put them in for that. It'll also say that on their DD 214 if they were in any form of the Persian Gulf locations during that time. We also put them in for any operations. This will also be on their DD 214. Operations of contingency operations such as Operation Enduring Freedom, Operations Freedom Centennial, Operation New Dawn. Any of the contingency operations will be on their DD 214, or they may have military orders that they can bring into the office. If they do it in person, they can bring it in the office, and we can look at their DD 214 and see if there's any form of operation on their DD 214 at the time. Um, to become anything anything pertaining to the Vietnam era, you is also based on their DD 214. We'll also see a type of service medal on their DD 214 if they were in there. If they were in there during the time of the Vietnam era, it'll say Vietnam Service Medal or VSM. If it says anything of service medal such as Vietnam Service Medal, I apologize. Vietnam Service Medal or AFSM, any VSM. I apologize, my brain's kind of scattered. VSM or my computer is acting funny. I'm sorry. So any VSM, a Vietnam Campaign Medal, Armed Forces Expeditionary Medal. If it says any of those types of medals on their remarks, that'll help us determine that they are in the Vietnam era veteran VA healthcare eligibility. We'll also base it on the time that they went in. Uh, any veteran who served during the period of January 9th, 1962 and ending on May 7th, 1975 is deemed the Vietnam era. So once we see that on their DD 214, we'll mark in the system Vietnam, and it will also help them with their priority group status as well as where their copays will be during that time as well. So once we submit what's known as a heck alert, we explain to the veteran that it'll take approximately 7 to 10 business days to receive some form of a letter in the mail indicating whether or not they were deemed eligible under the VBA. The VBA will do a more in-depth search of their records and indicate whether they are eligible for any form of the TARA or PACT Act, anything from Agent Orange to ionizing radiations. They'll do a more in-depth search once we submit the heck alert and see if they can become eligible for the TARA Act or the PACT Act. Time in the service, time in the service, it matters during this time, but if we submit a heck alert during that time and they are eligible, then they'll be placed in a certain priority group at this time.
And Ms. Moses, did you have anything else to share? Are you through with the presentation?
Um, we highly encourage veterans who served during this time to submit any form of paperwork pertaining to the PACT Act or the TARA Act, to reach out to their VBAs or to reach out to their doctors so that way they can put all their medical records in the system so that way we can look at their records as best as we can to see if they are eligible for any form of the TARA Act or PACT Act and service them in any way, shape, or form we can. And yeah. As I said, there are 4 ways you can go about enrolling. You can go to our website at va.gov and click on Apply for Healthcare. You can call our national enrollment line. The number has since changed. The number is 877-222-8387. You may also have an application mailed out to you. Um, the address on here, it is on the application, but we highly recommend that you mail it into the enrollment center if you can, just because we can open it and see it in a timely fashion and place the veteran in the system if they've never enrolled before. Or they can come in person to the Baltimore or Perry Point, Maryland VA enrollment centers. For the Baltimore side, we're open 8 a.m. to 4 p.m. No appointment required, and they can sit with us. We usually can get them out in about 20 to 25 minutes, depending on if the veteran is a service-connected veteran, as well as if they've already been in the system and they just need to refresh their VA healthcare at the time and re-explain their benefits to them.
All right. Well, thank you so much, Ms. Moses. We really appreciate that overview and all of the updated information. And I do see some questions that we'll get to in the Q&A session. Next up, we have Ashley Hanahan, who's going to provide us more information about toxic exposure screening, the program, and the processes involved in that. Take it away, Ashley.
Okay, thank you, Dr. Jacoby. Can you hear me okay?
We can.
Great. And I think you'll be navigating the slides. So next slide, please. So my name is Ashley Hanahan. I'm a nurse practitioner and I am a program manager for compensation and pension, but also one of the toxic exposure screening navigators and a registry clinician or examiner. And I'm pleased to speak with you today about the toxic exposure screening process in VA. And as previously mentioned, the PACT Act has really been fundamental at changing not only eligibility for healthcare, but also as it relates to VBA benefits, owing to conditions and expansion of presumptives for service connection for veterans. And we'll touch on some of those here in this presentation. So what is a toxic exposure screening exactly, and who's eligible for it? Well, all veterans who are enrolled in VA healthcare are eligible for this screening. It's a brief, basically questionnaire that lasts about 5 to 10 minutes, where we are simply asking veterans to identify and document any potential exposures to toxins during military service. This screening occurs every 5 years at VA medical centers, typically at primary care visits, but certainly can occur in other encounters. And the reason we're doing this is not only to support the long-term health care plan of veterans, but also to be sure that they're receiving whole health care and that's really veteran-centric and exposure-informed care. Next slide, please. So as I mentioned, the PACT Act really, established and expanded presumptive service-connecting conditions. And specifically, there were over 20 presumptive disease entities that were added to related to the toxic exposures. Many of these are pertaining to Gulf War and post 9/11 veterans, and I'm not going to read the list, but obviously it's rather comprehensive. It covers multiple body systems. Unfortunately, there are quite a few cancers on this list, but additionally, certain things that are largely respiratory in nature, such as chronic rhinitis, sinusitis, and other lung diseases. And then for Vietnam veterans and other veterans exposed to herbicides, hypertension was added to the list, in addition to a condition called MUGUS, which is sort of a type of pre-malignancy blood-related disorder. Next slide, please. So what is considered a TERA, which is a toxic exposure related activity? And so, it's really a broad catch-all category of many things. It might be air pollutants such as burn pits, sand, dust, oil well fires. It could be a variety of chemicals such as pesticides, herbicides, or depleted uranium. Occupational hazards that might be unique to a veteran's military occupational category. So asbestos, PFAS like firefighting foams. Could also include things like radiation, whether that's nuclear weapons handling or it might be even as an x-ray technician if someone worked in a medical center. And then certainly, of course, warfare agents such as nerve agents, chemical and biological weapons. This is not a comprehensive list, and it's certainly no particular timeline, but there is a very helpful website that I would steer all veterans to, which is publichealth.va.gov. Lots of good information on there, broken down according to time in service, location of service, and also things relating to particular exposures. Next slide, please. So filing and processing of claims associated with the PACT Act. And so there is a link here, www.va.gov/PACT. And the main thing I want to emphasize on this slide is, and I've been performing compensation and pension exams for over 20 years. I can tell you that prior to the passage of the PACT Act, there, oftentimes veterans would file a lot of claims for conditions that they felt were related to some toxic exposures. But at those times, or during that time frame, many things may not have been presumptive or widely recognized or formally recognized by VA. So it's important to realize that if you were denied a toxic exposure related claim previously, it's important to file a supplemental claim using VA Form 20-0995, a decision review request, or at the very least to refile for the condition. And that's important because the VA is not going to automatically re-rate claims for which there was a prior denial. And we want to be sure that you are aware of your rights to refile for these claims. And certainly veteran service officers can be very helpful in this regard. You can submit any new medical evidence that you may have or lay evidence along with the claim or simply refile relating to the prior denial. Next slide, please. So next steps, there's some very helpful websites, and I think all this information will be available to participants, but learning more about the PACT Act, as previously mentioned, about applying for VA healthcare. Also on the VA website is a very helpful site in order to file a VBA claim directly if you would like to do that through e-benefits. And then lots of information in particular about the registries, registry examinations, and how to verify whether or not you're in a registry or to join a registry. Next slide, please. Here's some very helpful contact information and telephone numbers. Again, my name is Ashley Hanahan. I'm one of the toxic exposure screening navigators. And next slide, please.
That's it for the slides. We can go back to Dr. Jacoby.
Okay, great. Thank you so much for that. And I'll put my contact information in the chat if it's easier for viewing that way. And participants are welcome to call me to ask any questions about toxic exposures, filing claims with compensation and pension, and also registry examinations. And thank you for your time today.
Thanks so much, Ms. Hanahan. That was a really informative presentation. I wanted to thank Ms. Moses for her earlier presentation as well. We're now transitioning into the question and answer portion of our session today. Just a reminder to protect your privacy, please do not share any personal health condition information or any personally identifiable information in the chat. You can post any questions to the chat, or if you cannot access the chat, you can email your questions to vamxpublicrelations@va.gov. That's VAMHCS Public Relations altogether at va.gov. Okay, now let me take a look at the chat here. We did have some questions that were put in earlier and actually were already answered, which is great. Means we're hopefully doing our job here. And I'm going to scroll up to the top. Okay. There was a question early in the session from Sonia. It says, question requested medical records over a year ago, and I still have not received records. I went in to the military after 1980. I believe that I enrolled in benefits. So the first thing I will say is I'm sorry to hear there's been a delay in you receiving your medical records. And there's lots of different ways that people can request records. I'm not exactly sure how you did request them, but our medical records office here in Baltimore is located on the third floor, and veterans often go into the office directly. They fill out the proper paperwork and they make the request. And our medical records subject matter experts do their best to process requests within 30 days. Sometimes it depends on the size of the records or the type of records that you're requesting. It might take longer. Is there anyone else on the call that can talk a little bit more about our medical records process and other than what I just shared?
And Dr. Jacoby, I also wonder if that question is about medical records from the military, because the person also mentioned when they were listed. So I did drop a few links in the chat on where veterans can request their military medical records. But if anyone else can speak up about that, that'd be great.
Kenya, I'll say that's an excellent point. As people are thinking about the presumptive eligibility and applying for service connection, it's an amalgam of all your records. So it does include and can include your VA medical records, but it also can include your military records. And, you know, on the VA side of the house, we try our best to facilitate medical records from the care that you receive here in this institution in VA Maryland. The military side of the house, that process is, you know, can, we don't have any control directly over that, but I know that it can take some time to get those records, especially if there were some challenges in, individuals sometimes are deployed to lots of different locations, and it does take time to get all of those records back into one file for veterans. What I will say is if, Sonia, if you're talking specifically about VA medical records, I again reiterate that we try to process those within 30 days. And the best way actually for you to help facilitate it is coming into the facility and filling out the release of information. Those medical records are indeed your records. They're only your records. And so essentially you're authorizing us to release those to you. And then once you receive that copy, you can send those records to whom any person that you feel it would be in support of your claim. It could include a veteran service officer. It could include others. And thank you, Ms. Griffin, for placing some of that information in the chat. Okay, now I'm going back to the chat to make sure that I'm not missing any questions. Give me 1 second. There was a question related to whether or not asbestos exposure was covered. Ms. Hanahan, I know that you had a slide that talked a lot about all of the different potential toxins. Did you want to say any more about asbestos specifically?
Sure. And so what I always encourage veterans to do, although asbestos is not a particular presumptive condition, because it's considered an actual type of, chemical or environmental exposure. And so one thing that's important is, although there's not a specific registry for asbestos, you can certainly request a medical environmental exposure examination through our registry department, which is sort of a catch-all physical evaluation and a really extensive interview with regards to all of your military toxic exposures. And so that's a very good way to sort of consolidate and concisely document all of the exposures you've had, and that way it can become part of the VA medical record. It's important that it can inform your VA healthcare, but also can be helpful in applying for VA-related benefits. And you're welcome to contact me directly at the number I listed, so that if you want to talk more about this, I'm happy to do so.
Excellent. Thank you, Ms. Hanahan. Our next question was from Brian, and the question was, how does the VA make determination on what was or slash is service related? For example, he shared some information about his specific condition, but it was essentially rated as not service related. I know that Mr. Filsinger is on the call. I don't know if you wanted to speak a bit about the overall process about how, the VBA makes that determination.
Sure. Thank you so much for the question, and good afternoon, everyone. So generally speaking, the process of service connection there is really, if you think of it like a three-legged stool, one leg is an in-service event, condition, diagnosis, something that occurred in service. Then there is a post-service diagnosis. So one transitions out of the military, there's a current diagnosis of a condition, an ongoing treatment plan for a condition. And then the thing that links them is what's known as a nexus. And so those three things are what's utilized to grant service connection in the majority of cases. And so again, that three-legged stool would be the in-service event, disability, condition, etc., the post-service event, and then the nexus that draws a distinction between the post-service event and the in-service event. So generally, we see that in the form of a VA examination. So for example, examiner X says that the condition or the event that occurred in service did subsequently cause X condition, and then VBA would utilize that as the basis for granting service connection. Now, with regard to presumptives, slightly different in the sense that if a condition is diagnosed that is on the presumptive list, such as Ms. Moses had talked about earlier, and you served in one of those areas, then the presumption is that nexus exists between your service in that particular part of the world and the subsequent diagnosis of that condition. But that particular method of granting service connection is reserved for those conditions that are considered presumptive conditions. I hope that information is helpful.
Thank you very much.
Dr.
There was
Jacoby?
oh, yes.
I'm sorry, this is Kitten here. Before we go to the next question, I just wanted to remind the attendees that our presenters and our subject matter experts are able to speak, but we're only taking questions from the attendees in the chat. If you are not able to place your question in the chat, you can feel free to send us an email at vamhcs.publicrelations@va.gov. That's VAMHCS publicrelations@va.gov. And we'll try to answer your question, or you can use any of the contact phone numbers that we have placed in the chat or on the screen. Thank you.
Of course. And there were a few questions, as you mentioned, related to phone numbers, and we're displaying that currently on the screen. The Eligibility and Enrollment Center phone number is listed on the screen, 877-222-8387, and there are others in the chat. So as I scroll down, there was a question from Camelia. My apologies if this was answered. Paperwork should be submitted to see if we qualify for the PACT Act. I think Ms. Hanahan talked specifically about that process. Ashley, is there anything else that you wanted to comment on regarding the kind of paperwork involved?
Sure, Dr. Jacoby, and I'm not sure in this particular case if this relates to VA benefits or eligibility for health care. But with regards to access to VA benefits, certainly, and I would recommend probably just that you give me a call directly so I can kind of walk you through the steps on how to file a VA claim. You have several options for that. A paper application, electronically through e-benefits, or utilizing the assistance of a veteran service officer, which can be very helpful, particularly if you are new to this process. Well, with regards to paperwork for eligibility for health care, I would refer you back to Ms. Moses, who's the subject matter expert on that in enrolling for VA health care. Thank you, Dr. Jacoby.
Yes. And Ms. Moses, did you want to add anything to that? You might be on mute. Okay.
Dr. Jacoby?
Yes.
This is Aaron from the Veterans Benefits Administration. I can speak briefly to the benefits paperwork if you would like.
That would be excellent. Thank you.
Certainly. So, to the question, if you were denied service eligibility for a specific condition prior to the PACT Act, should we reapply? The short answer there is absolutely. You should apply for any benefit or entitlement that you believe that you've earned through your service. And so I would actively encourage you to file that claim. There are a couple of ways to do that. I will drop them in the chat here following my relay of the information. But you can submit a paper application via mail to our claims intake center in Janesville, Wisconsin. You can also fax that application into the national 1-800 number. If you prefer to work with someone to file that claim, you can visit our regional office in Baltimore. We're located in the Fallon Federal Building at 31 Hopkins Plaza. We're on the first and second floors of that building, and we can assist you there. You can also submit a claim for benefits online at www.va.gov/disability. So I would highly encourage you to resubmit or reapply for benefits if you've applied before and been denied, especially if that application was prior to the PACT Act. With regard to the second part of the question, is it retroactive to the initial filing date? So each condition is going to be a little bit different. It's difficult for me to give you a concrete answer. And so what I would say is that might be an opportunity where you may want to work with someone directly at the VA regional office, or if you're represented by a service organization, they can assist you in completing the application and answering that question based on your specific set of circumstances.
Thank you very much. That was very comprehensive. Looks like the next question was, does the PACT Act include the Camp Lejeune water containment? Ms. Hanahan, did you want to comment at all about Camp Lejeune water?
Sure. And I would also point to Mr. Filsing's reply as well. So Camp Lejeune is a little bit of a unique animal. There are presumptive health conditions relating to Camp Lejeune exposures. There's also a separate category for family members or others who are not veterans, but were actually at Camp Lejeune that have some special eligibility for healthcare related reimbursement, essentially. The other thing I wanted to mention is that with regards to Camp Lejeune, the registry for Camp Lejeune is actually maintained by the U.S. Marine Corps versus the VA. And I did place a link higher in the chat with regards to the website and for those who would like to join the registry for Camp Lejeune. And again, just to reiterate, anyone is welcome to contact me if they have specific questions about health conditions related to Camp Lejeune, or can also visit the VA website, which is publichealth.va.gov.
Thank you. And Mr. Filsinger, anything additional to add to Camp Lejeune information?
Certainly. Thank you for that opportunity. Again, I would say if you have applied for benefits before and the claim has been denied, or if you haven't filed a claim before, I would highly recommend that you do. There are provisions within the regulations that govern VA benefits that allow for recognition of presumptive disabilities associated with exposure to contaminants in the Camp Lejeune water supply. And so there are some specific service time periods that are encompassed in that guidance, and there are a set of 8 conditions that have already been identified as presumptive conditions. Again, you can work with the local regional office or your VSO if you have one, but I can briefly touch on those. VA does acknowledge the following disabilities to have a relationship with exposure to contaminants in the Camp Lejeune water supply during the period of August the 1st, 1953, and ending on December 31st, 1987. Those conditions include kidney cancer, liver cancer, non-Hodgkin's lymphoma, adult leukemia, multiple myeloma, Parkinson's disease, aplastic anemia, or other medioplastic syndromes, and bladder cancer. Again, a lot of information. I don't expect everyone to retain that from me rattling it off. So I would highly recommend reach out to your local VA office. You can also reach us at our national 1-800 number where we have call agents ready to assist, and that's 1-800-827-1000. Thank you.
Thank you very much. The next question in the chat was related to shipyard and shipboard toxic exposures. And Tim had asked, how do I even begin to list what those were? I think that during Ms. Hanahan's presentation, she talked about the process by which veterans undergo toxic exposure screening within VA Maryland. And certainly that evaluation allows for veterans to be able to share the different experiences that they had while deployed, and it would include an individual who was, deployed over the seas on a ship. Anything to add, Ms. Hanahan?
I believe Ms. Hanahan had to
looks like-
step away. So
yeah,
if there are
looks like she
any
had to
other
step away.
questions, if there are any other questions, her telephone number is listed in the chat and on the screen, and you can certainly follow up with her directly.
Thank you. All right, Tim asks, if we are using the universal healthcare system, do we need to bring this up to our PCP within the VA? I'll just say generally, I think it's always excellent to communicate as much information that you can to your primary care provider within VA Maryland, because it helps us coordinate your care. I know that Dr. Khosla is on the call today. Dr. Khosla, did you have anything in addition to add regarding universal healthcare system questions?
Now, just to second what you said, Dr. Jacoby. So as a primary care physician in the VA, we have access to some records from other places, but it's always better to bring more records rather than less records. So it just helps us take better care of you.
Thank you. Looks like Dominic had a question regarding hypertension or high blood pressure and essentially the association between Camp Lejeune water contamination. I think Mr. Filsinger did a nice job of overviewing the presumptive conditions that are related to Camp Lejeune water, and I think any other further questions could be answered through, Veterans Benefits Administration service rep. See, as I scroll down here, I don't want to miss anything. And then I see Ms. Griffin had added some information regarding the release of information, medical records, phone number. Thank you, Ms. Griffin. I appreciate that. Okay. Scrolling through, there are lots of questions regarding the Camp Lejeune that I believe Mr. Filsinger had addressed already. A question from Sandra: how, if you are missing VA medical records from a location, so it sounds like the question is, if you are receiving care at multiple locations from VA Maryland, that's my interpretation. How do you obtain those? Our medical records office houses essentially your entire VA medical record, and it's not necessarily housed in different locations, but it does encompass all of the care that you receive. So when you do communicate with medical records, they can help facilitate you getting your VA medical records. If you're referring to military records, it's a different story because, it depends on the branch where you served. There are, as you know, many veterans who serve in multiple branches. And so if you're going to get the entirety of your medical record, you may actually have to reach out to multiple agencies with DoD to get those. Hope that answers that question. Okay, I'm scrolling down here. And then there was a question from Jesse. Looks like how would you go about getting screening regarding exposure? And I think that, yeah, there was a comment there and lots of thumbs up. I think Ms. Hanahan, when she was talking about the extensive screening that's done through toxic exposure, we really take that into account. The other thing I'll add is you don't have to wait for the formal toxic exposure screening. If you feel like there's concerns that you have, you can always speak to your primary care physician. You can speak to other providers within VA about that. And then those clinicians will provide the extensive assessment that is needed to kind of get to the bottom of some of your concerns. So it's a great question. Okay, let me scroll down. We have some other repeat questions here. And I see that Ms. Hanahan put the Registry and Environmental Exposure Coordinator information for Ms. Regina Moore and her contact information, which is very helpful. Ms. Griffin placed in a very specific link for PACT Act and your VA benefits. That will be helpful. And then I see Mr. Filsinger added some very nice information into just, how you navigate applying for the disability compensation and related compensation benefits, and a lot of really good information there. Okay. Okay, and then there was the last question was, thank you for putting this together. Any chance this PowerPoint will be available later? We mentioned that there is a recording and that will, that you can actually listen to. And so you'll be able to listen through, because there was a lot of information that was presented today. I'm not sure I was able to retain all of it. And so going back and listening to the recording, I think will help you retain some of that information. And what's nice about the recording is you get to see the slides as they progress through with the narration. So that should be very helpful. Okay, let me check the chat to see if there's anything else. I think we covered everything in the chat. And so I just wanted to thank all of you for joining today. And we hope that after listening to the information session today, you'll consider taking advantage of the expansion under the PACT Act and apply for VA healthcare if you're not already engaged in VA healthcare. We also want you to feel free to share information that you learned today with other veterans so that you get the word out, and so you can help us get the word out, and so that those individuals are able to connect and receive the benefits that they've earned through their military service. Looks like we also have the post right here. Ming had added that the recording will be posted on the website. And if you would like a copy of the PowerPoint slides, just email vamexpublicrelations@va.gov and they can send you a copy of the PowerPoint slides. Thank you so much, Ms.
You're welcome.
Vincenti, for adding that.
Dr. Jacoby, also, for some reason, it will not let us attach them to the chat until after this call is over. But as soon as the call is over, I will post them in the chat. And if you're able to access it afterwards, you can open up the slides from there. And if that does not work, please do email us and we'll be happy to email you a copy.
Thank you so much.
Thank you.
So just wanted to conclude for today. All of the information is in the chat. It was a pleasure presenting. I wanted to thank all of our presenters for sharing, as well as our subject matter experts. And we hope after all of this information, if you're not engaged in VA Maryland care, that you consider us as your finest healthcare provider in the country. We hope that everyone has a fantastic day, and stay warm and stay safe. It's very cold and very icy out there. Thanks so much. Bye for now.